Severe chronic headaches. Consider the company that you're in. Albert Einstein, Ulysses S. Grant, Friedrich Chopin all suffered years of intense headache pain. And it's said that the world of Alice in Wonderland was shaped in part by the author Lewis Carroll's migraines, which distorted his vision. Today, an estimated 40 million Americans are tortured by frequent headache pain. Is there help for some of them? Yes, there is. Though it's not widely publicized, we have found that there are specialists who treat only headaches. And what ABC News medical editor Dr. Timothy Johnson has learned from them could be good news for people like these.
Well, it feels to me like the blood vessel is just going to burst.
There's a fist behind your eye, and it is trying to knock your eye out of the socket.
And it's like I have a hammer in my head, just pounding.
What these people are describing is a real headache, not the take-two aspirin variety, which affects all of us occasionally. People who don't have severe headaches find it hard to understand how headaches can be so bad as to affect a person's entire life.
Morning.
14-year-old Christopher Reed of Atlanta has had headaches since he was 10.
Do you have a headache today? No. Good.
Morning is the time that Christopher is most likely to have a migraine attack. Last year, he missed 38 days of school because of headaches.
It's real bad, then I just have to stop everything, and then if it's not so bad, I can at least watch TV or something. Rheumatologist?
A rheumatologist.
Christopher was lucky. He had parents who took his pain seriously.
When he came to us with the headaches, it was obvious that he was in a lot of pain.
My concern is how can I help this pain go away?
However, many headache sufferers, like Judy Stoller of Massachusetts, get no sympathy.
My husband, I think initially, was understanding to a point, but having never really experienced headaches of any sort, of any kind, he could not relate to the difference between migraine intensity and just a normal headache.
Both Judy and Christopher saw a lot of doctors before they got help. Christopher's parents tried a pediatrician, a neurologist, and a chiropractor.
I was praying constantly. I was pulling my hair out. I was spending whole days trying to find anybody that had any cures or remedies for migraine headaches. I probably would take them to a witch doctor. I mean, they're desperate.
That kind of desperation led Judy Stoller to the Faulkner Hospital Headache Clinic in Boston, the oldest of the half-dozen headache clinics totally specializing in headache problems. Dr. Agelia Spearings heads the clinic.
Is it the same on both sides?
No.
Treatment does not focus on taking away the symptom of the pain by the use of pain medications, but that we try to alleviate headache by affecting the mechanism of the headache.
When doctors talk about mechanisms, they are talking about underlying causes of headaches. And scientists believe that most headache pain is caused either by prolonged contractions of head and neck muscles or by excessive widening of blood vessels in the head. Severe headaches come in a variety of forms. The three most common are tension, migraine, and cluster headaches. In tension headaches, victims feel the pain all around the head like a hatband. It's usually a constant ache. Migraine victims feel pounding on one side of the head with visual distortion. Even more severe are cluster headaches, which involve intense one-sided pain. In addition, the eyes tear and the nose clogs. Oddly, cluster headaches can attack consistently and then not recur for days or even years.
That suggests a little bit of muscle contraction, but actually it looks fairly normal there.
These days, doctors are using sophisticated techniques like thermograms to help them figure out the root causes of a patient's pain. But because headache pain is subjective, the best diagnoses are made on the basis of what patients tell their doctors.
I had a touch of a headache last night, but it's gone away this morning.
Any nausea or vomiting?
No, I've had a little
And since the patient's story is so important, doctors are trying some new and unorthodox ways to help patients tell their story.
I would like you very simply to select 3 colors that best describe how you feel when you have a headache.
Doctors have found that for some patients, drawing it out is easier than talking it out. These are drawings made as part of a migraine art show in England. 200 works were selected from a field of 800 entries, all exploring the physical and psychological components of a headache. Doctors study the artwork to get clues about causes.
this kind of communication from the patient, which is not originated by the physician, but comes from the patient himself, can teach us a great deal about what else may be involved.
By the time most patients turn to headache experts for help, they usually describe a very real problem, namely the excessive use of a variety of pain medication, much of it prescribed by previous physicians.
That's perfect for Palm Springs, too.
Until she got help, Judy Stoller had a medication history that sounded like that of a drug addict.
He combined actually Fiorin Aldavon and Davocet N100. I was on Isoptin, then I was on ergotamines, Cafragot. I also was on a sleeping pill, Dalmane. I think at one given point in time, I probably was swallowing, mixing eight different kinds of pills.
The drug abuse that is so typical among severe headache sufferers like Judy Stoller often begins innocently enough with an abuse of over-the-counter drugs.
I've got a headache this big, and it's screaming for Excedrin.
Excedrin, the headache medicine.
So you've got millions and millions of people with daily headache, and they're looking at a television commercial, and it says, you know, take 2 of these. And these people say, well, if 2 don't work, let me take 4. I have people that take a handful of pills each time they take pills 4 times a day.
For the last 5 years, headache specialist Dr. Alan Rappaport has studied headache patients who abuse headache remedies. About 30% of the patients in his Connecticut clinic suffer what's called an analgesic rebound headache. Taking the medicine makes them worse.
I'm not saying aspirin is a bad drug. I think it's a great drug, and I think it works very well in certain types of headache when not abused. But I am saying if you have the wrong type of headache and you take the wrong type of medicine in the wrong dose, it's going to make you worse, and we'll have to stop that to make you better.
Doctors can usually wean patients from drugs that are bad for them on an outpatient basis. But that's not always possible, especially for long-term multiple drug users. For them, doctors sometimes have to recommend hospitalization.
Not too many headaches?
No,
Dr. Seymour Diamond is a pioneer in headache treatment. His Diamond Headache Clinic opened in 1974, and 5 years ago, he established this inpatient unit at Chicago's Lewis Weiss Hospital.
Okay, no problem.
No headaches?
None this morning.
What about last night? How'd you do?
Slept good, no headache last night.
There is a hardcore percentage, I would say, of patients that we see, maybe 20% of the total patients we see on an office basis that do not benefit. And we're taking this group of patients and helping them.
Infrequently, patients going through drug withdrawal experience serious side effects, like seizures. Albert Fiala had only been in the hospital for a short time. Because he was there, doctors were able to bring the seizure under control.
This probably won't happen again, and I'm not concerned about it.
Currently, there are only 2 hospital inpatient units in the country that totally specialize in the care of headache patients. One is the Diamond Unit in Chicago. The other is the Michigan Headache and Neurological Institute in Ann Arbor. But in a few months, there will be another located on the East Coast under the supervision of Dr. Rappaport.
You know these shirts you made us for us? We like them a lot. We'd like to know if...
Nightclub owner Doris Morell is one of Dr. Rappaport's success stories. Before she got treatment, she suffered 4.5 years with severe headache pain, the result of several car accidents. Now clear-eyed and energetic, Doris once led a fuzzy existence, addicted to a powerful narcotic.
I would have to schedule my days around when I took the Demerol. I would have to say, okay, you know, you could take it to get the kids off to school, then suffer the rest of the afternoon. And if you want to cope with the children, then you wait until 3 o'clock to take your second one. You know, and it really, I had to really schedule my whole life around the Demerol.
Husband Ellery helped her weather 10 days of hospitalization. The result was a strange new sensation for Doris, one that many former severe headache victims have difficulty accepting.
I was home maybe 3 weeks, and I kept on hitting my head. Ellery would say, Dora, what are you doing? And I was like, nothing. I said, I'm trying to feel like what's wrong with my head. And he goes, well, what does it feel like? I said, nothing. You know? And he said, that's how everybody's head feels.
Doris continues to have follow-up visits at the clinic. As good as she feels, she is not cured. She still gets some headaches, but they are far less frequent and a lot less severe.
Tell me what medications you're taking at the present time.
I'm on Verapamil, 80 milligrams, 4 times a day.
Verapamil, a so-called calcium channel blocker, is one of the preventive medicines often prescribed today by headache specialists. Along with beta blocker drugs like Inderal, calcium channel drugs are widely used to treat heart and blood pressure problems. And more recently, they have been found useful in reducing the number and severity of headaches. In addition to withdrawing patients from traditional pain medication and using newer preventive medicines, headache specialists often use non-drug methods of treatment, such as diet modification or stress reduction with biofeedback. Studies have shown that measuring body responses, such as muscle tension, with biofeedback are particularly successful with younger patients like Christopher Reed. He learned the technique from Atlanta psychologist Dr. Paul Fair by learning to visualize mental images that produced less tension in the muscles of his head.
Just see if you can drop this down to that lower line.
I use a kind of imagery that Dr. Fair taught me, where I use topping off the tank, where I put energy in my head on the side that the headache is on, and that usually makes it go away.
Many other headache sufferers have found that changes in diet are very helpful, especially the avoidance of certain foods like red wine, chocolate, or aged cheeses. Whatever the technique, headache victims are grateful to be headache-free.
When I see people reach for Tylenol very routinely, as most people do, I say to myself every once in a while, gee, I'm an awfully lucky person. I don't have to do that anymore.
What can I get for you, dog?
I am now 100% narcotic-free and 95% headache-free. Now today, for the first time in probably 6 years, I feel like I am in total control of my life. And it's like reliving your life all over again, like starting all over again. It's wonderful.
Tim, how bad should a headache get before somebody seeks medical help?
I think anybody should seek help when they think headaches are interfering with their life. For some people, this will be a severe